Babies cry because of many reasons, out of which one major reason could be teething. Teething is basically the process of eruption of teeth through the gums. Well, it's a very painful process for the baby, but keep in mind one thing, that teething is not a disease, it's a process. You have been through it, I have been through it, and it is very important for the child to have eruption of teeth at the right age. So the first set of teeth, that is 20 teeth that a child is going to have after the process of teething is over, they are called milk teeth or primary teeth. Well, you will be surprised to know that the development of primary teeth starts when the child is still in the womb. Somewhere around 5 weeks of gestation, the first buds of primary teeth appear in the baby's jaws, which are hidden under the gums. 10 in upper jaw and 10 in lower jaw. Let me first show you the different kinds of teeth that the baby is going to have. Number 1, incisors. Now they rhyme with scissors, so that's the reason why they have a thin cutting edge, and that's used for cutting the food. Now number 2 are canines. Now these kind of teeth have a pointed end, and the reason for having pointed end is to tear the food. So the third ones are the premolars. Now premolars have a flat surface, and the purpose of having a flat surface is to crush the food. Now the fourth ones are the molars. Now these molars are larger than the premolars, and they are broad, they are flat, and their purpose is to grind the food. Now parents, let me share with you the positive side of teething. Of course, now we know that the teeth of baby help in chewing the food, in biting the food, in grinding the food, in crushing the food. But apart from all this, teeth give the baby's face its proper shape and form. Teeth also help the baby to speak. One of the major milestones during the first year is the appearance of the first tooth of the baby. But keep in mind one thing, that the timeline of the eruption of teeth is different for different babies. In some cases, the first tooth may appear after few months of birth, but in some cases, teething may not start until 12 months. So here I am going to share with you a general timeline for the eruption of different kinds of teeth. So here is a timeline of the teething process that takes place in a baby. You can see that the first two are the incisors. They are the top incisors. These are the bottom two incisors. Now the two teeth that you see on either side of the incisors, they are called lateral incisors. So they are 2 on top and 2 on bottom. Now these pointed ones, as explained to you earlier, these are called canines. So 2 on top and 2 on bottom, 2 at the bottom. And these are the premolars, the molars, the flat tooth which is right behind the canines. These are the premolars. They are also called first molars. So again, 2 on top and 2 here you can see at the bottom. And lastly, the molars, the broader ones, the broad molars. So again, 2 on top and 2 at the bottom. Let me tell you the order of appearance of teeth in babies. So first, the first ones to appear are the incisors, the 2 incisors which are there at the bottom. Now these incisors, they erupt somewhere around 6 to 12 months, and the upper 2 incisors, these two, they appear somewhere around 8 to 12 months. Now after the incisors erupt, it is the lateral incisors, the 4 on either side of the central incisors, they erupt, and they also erupt somewhere between 8 to 16 months. Then after incisors, it's not the canines which erupt. The first molars, the premolars, they erupt after the lateral incisors, and the lateral, these first molars, they appear somewhere around 13 to 19 months. Now after the first molars or the premolars, it is the canine which erupts. Now canine erupts somewhere between 16 to 24 months, and after the eruption of canines, it is the turn of the molars, the big molars. They erupt somewhere around 25 to 33 months. So generally by the age of 3, a child has full 20 teeth. So the process of eruption of a tooth takes place in approximately 8 days. 4 days prior to the emergence of the tooth, the day of emergence, and 3 days after the emergence of the tooth. 3 to 4 days prior to the eruption of the tooth, you will notice a blue-grey bubble on the gum. That's called eruption cyst. It goes away on its own, but parents, let me tell you that it's a very uncomfortable and a painful period for the baby. So what are the symptoms that you should look out for in a baby who's teething? The very first thing that you'll notice in a teething baby will be an increased urge to bite everything. Whatever they come across, they just want to bite it, whether it's your hand, their own hand, any object which is lying around. Second thing that you'll notice is that there'll be a lot of drooling, a lot of saliva which will be dripping out of the mouth, because teething is something which stimulates the production of saliva. Another thing that you'll notice in a teething baby is a lot of gum rubbing. They'll either start slapping themselves, they'll start rubbing their gum or hitting their gum. And one major symptom that all the parents, I'm sure, would agree with me is increased irritability. The child would be irritated all the time. Another thing is sleep regression. It's not necessary that all the babies who are teething will have sleep regression, but in most of the cases, babies have a lot of wakefulness. They don't want to sleep, or in the middle of the night they would wake up and they would start crying. They would be cranky. There will be a decreased appetite for solid food, because as it is, the gums ache, so they don't want to chew, they don't want to bite. They don't want to make use of their gums. Teething babies can have mild fever, but this fever is due to the inflammation of the gums that takes place while the baby is teething. Now the baby may also get diarrhea, but this diarrhea has got nothing to do with tooth eruption. It's because of randomly putting infected things in the mouth because of the urge to bite. So the symptoms that I have shared over here may or may not be associated with teething. So if you have slightest of doubt, please get in touch with the pediatrician. Now what are the ways in which we can help a teething baby? You can give the baby some chilled fruits to help soothe those sore gums. To prevent choking, you can put the fruit in a mesh feeder and then give it to the baby. Well, you can also give your baby a clean, cold washcloth. The thing is, you can wash your hands thoroughly and massage your baby's gums with your fingers, so that pressure also gives some sort of relief to the baby. So there are a variety of teething toys available in the market. You can just keep it in the refrigerator and hand it over to your child. If nothing works, feel free to ask your pediatrician for any medicine. And not to forget, mommy, give your baby plenty of cuddles, hugs, kisses. Trust me, your touch is definitely going to soothe the baby. So guys, this is CHICCO signing out from Momhood and Beyond. I hope I was of some help to the new parents, especially the parents who have teething babies. So if you've liked the video, do give a thumbs up. And don't forget to press the subscribe button as well as the bell icon next to it so as not to miss any video that I upload in future. Bye for now.